The American Psychiatric Association defines depression according to a series of criteria, and an individual who is diagnosed with depression has to have at least 5 of those criteria. It depends on the person, so we tend to think that experiences like loss, if somebody close to you dies, that can be something that can lead to depression. Stressful life events of any kind, be it relationship problems, transition, early periods in college are a time that people have a lot of difficulty oftentimes. Job loss is another kind of stressful event. But then there are some people who experience depression. We think that it's more biologically driven, and there aren't always specific triggering events that happen. The prevalence of anxiety disorders differs by which anxiety disorder you're talking about. So some anxiety disorders, like generalized anxiety disorder, which involves more worry, tend to be more frequent than other anxiety disorders that are generally a little bit more difficult to diagnose, and people tend to have more specific symptoms like obsessive compulsive disorder. But we know that up to 40% of people in the population have some difficulty with anxiety, oftentimes not to the level of diagnosing an anxiety disorder. Some people with really severe anxiety don't tend to leave their home or kind of engage in their regular activities. So it leads to a lot of impairment for the people that are experiencing difficulty, and a lot of suffering on their part, as well as can be just really challenging for other people who are trying to interact with people that are anxious and trying to make them feel comfortable. Family members are often negatively impacted because the person with anxiety has a lot of difficulty doing the kind of typical activities of their daily life.